Well, what a great intro to this morning for some of us, or this afternoon for others. Welcome to Zone 3334's Zoomformation, the last one for this calendar year. And I would like to thank you all for spending your time this early December, coming aboard with us here. Great to see those smiling faces. Before I start, I have a message from Peter and Margaret, who are both on their way today to a well-deserved trip to my district, District 7020 in the US Virgin Islands. So they were going to be here on the call, but his trip was delayed for a day because of COVID testing. So he's actually traveling today, right as we're speaking, but he'll be watching this later. So he sends his apologies, and he wants to thank everyone for their support during the past 6 months. It's been an interesting time as we transition from virtual to somewhat back to normal in some parts of the world. We've still got a way to go, but Peter definitely has appreciated the support he's got from all of us. And he also wants to extend best wishes for the holiday season and for a healthy and happy and prosperous new year to us all. And by way of a gift, you'll notice that I've got a Zoom backdrop here, a festive one. Some of you have them as well, but last week Rotary International very kindly sent out a whole selection of Zoom backdrops, and so what I'm going to be doing later on is sharing that link in the chat, and those of you who just want to click on that will be able to download a whole variety of Zoom backdrops that you can use to show how festive Rotary is during the holiday season. So we have a really interesting call for you today. Of course, as we know, this month is Disease Prevention Treatment Month, the Rotary Foundation, Rotary International's theme. We have three excellent presenters for you. So without further ado, I'd love to introduce my first presenter today, Dr. John Ward, who's going to give us an update on progress for the elimination of hepatitis. So Dr. Ward is a director with the Task Force for Global Health, guiding development of global viral hepatitis elimination program. And of his 13-year tenure as director, Division of Viral Hepatitis, Dr. Ward was responsible for viral hepatitis surveillance, prevention, and research. At the national level, Dr. Ward has led development of recommendations for hepatitis A and hepatitis B vaccinations, and hepatitis B and hepatitis C testing and linkage to care. He's authored the first National Action Plan for Viral Hepatitis Prevention, and also initiated an Institute of Medicine report on the status of viral hepatitis prevention in the United States, followed by a National Academy strategy to achieve hepatitis B and C elimination. Impressive. Dr. Ward guided development of two pilot projects for hepatitis C elimination, one for the Cherokee Nation, the other for the country of Georgia. And that's the country of Georgia, not the county of Georgia. Okay, globally, Dr. Ward serves as an expert consultant to the World Health Organization, including advising Western Pacific regional office efforts for reducing the prevalence of hepatitis B to less than 1% amongst children. He has authored over 150 publications of scientific work in viral hepatitis and HIV, and served as editor of CDC's Morbidity and Mortality Weekly Report, and also as editor of The Silent Victories, A History of Public Health in the 20th Century, published in 2007 by Oxford University Press. Dr. Ward is an adjunct professor of the Hubert Department of Global Health, Rollins School of Public Health, Emory University, Atlanta. Please help me welcome Dr. John Ward to our Zoomformation. Dr. Ward, over to you. You're muted, Dr. Ward.
Thank you so much for that introduction. Hopefully you can hear me now. It's really a great pleasure to be a part of this Rotary session. I've had such deep respect for the Rotarians' work to eliminate polio, of which the Task Force for Global Health is part of, that I'm well aware of the impact Rotary can have on health. In that regard, I wanted to give you a update and a little bit some information about hepatitis elimination and why it's important, how it can be achieved, and some of the involvement of Rotarians already, and some opportunities for the future. Quickly, the Coalition for Global Hepatitis Elimination is one of several disease elimination programs managed by the task force, including the polio elimination program that Rotary International is very committed to achieving. Basically, we work by developing a community of practice, bringing all the key partners together, industry, governmental, clinical, civil society, to fill important roles in an elimination effort. We bring credible information together to assist countries implement the key interventions needed to achieve elimination, and through all of that, mobilizing commitment to get the job done. Why is when we talk about viral hepatitis elimination, we're talking about two infections, hepatitis B virus and hepatitis C virus. These are blood-borne viruses, and they cause disease through chronic infection, as I'll show you in a moment. But in this slide, I just want to make the case that these are major health problems. Almost 300 million people living with hepatitis B at risk for death, as you see the large number of deaths there per year, and hepatitis C and the number of people living with that infection and the number of deaths caused by that. And these are blood-borne viruses, and so exposures to contaminated blood is the major risk. Importantly, the risk is highest for children born to infected mothers to remain chronically infected, followed by infants, and as I'll get to in a moment. And for hepatitis C, any blood exposure, typically through unsafe healthcare around the world, through unsafe injections, and then in developed countries such as the United States, particularly among injection drug users because of their unsafe injection risk. So the key points to call out here about natural history is that newborns are at the highest risk of becoming chronically infected with hepatitis B virus when born to an infected mother. And once infected, they remain infected for life typically, and have a 25% risk of dying prematurely from liver cirrhosis or liver cancer. For hepatitis C, 50 to 70% once infected remain infected, and 40% progress on to cirrhosis and then to liver cancer. Together, those two infections cause 80% of all liver cancer globally, which is the fourth leading cause of cancer deaths around the world. So in other words, this is a preventable cancer. Why is elimination feasible? Well, first and foremost, we have a highly safe and effective vaccine that prevents 95% of transmissions of hepatitis B when used appropriately, including giving what's called a timely birth dose within 24 hours of birth to a newborn, or completing a 3-dose infant immunization series through the regular infant immunization schedule. For hepatitis C, the key intervention, other than just avoiding blood contact, is the opportunity to test, find someone infected, and then cure them of their infection. We have these miraculous cures for hepatitis C, the first cure for a chronic viral infection in the history of medicine that can cure 95% of infections with 1 to several pills a day for 2 to 3 months, that now costs less than $150 per cure around the world. So that's the key interventions we have in front of us. What we can do to eliminate hepatitis, you see the immense benefits in the number of infections prevented and the number of deaths averted, as shown here. And it's highly cost-effective and cost-saving, which of course is very important to governments and health systems around the world. So we have a clear call to action, and we have clear tools to achieve these elimination goals. So I just have a couple of challenges to call out to you in our short time we have together. Number one, we have an immense task of finding those diagnosed, those infected people and getting them into care. As you can see here by these bar graphs, very few, most people have yet to be diagnosed with their hepatitis B and hepatitis C, because these are silent infections until right before the liver totally collapses from disease. So people are unaware of their infection unless they get tested and get into care for these life-saving treatments. One particular problem for the United States is because, as I've mentioned, hepatitis C virus is spread through exposures to blood. injection drug users at highest risk. And we've, as I'm sure everyone on the call knows, we've had this opioid epidemic going on for over 10 years now, and we've had an explosion of hepatitis C infections in the states, particularly that are shaded dark in this map. And those persons need testing and linkage to drug treatment, and as well as hepatitis C testing and treatment. So one example of Rotarians helping out with testing linkage to care is the Rotarian Action Group for Hepatitis Eradication that was started by a group in Brazil a number of years ago. Some of you already may be aware of this. I just wanted to, this was in part of their annual report that's available on the Rotary website, just showing the various outreach to promote testing and linkage to care for hepatitis C in Africa, the Americas, as shown here, and then also some parts of Europe have also taken on to this, such as in speaking to some Rotarians in Portugal, for example. And the Rotarians' activities have been around promotion, fundraising, and actually conducting these testing programs. The other opportunity is to help out with hepatitis B immunization. I've already pointed out the importance of hepatitis B vaccination given immediately after birth. Unfortunately, countries of Africa, even though their prevalence rates are the highest in the world, they have the lowest rates of hepatitis B vaccination. So as a result, 2 out of every 3 new hepatitis B chronic infections are in Africa because less than 10% of infants receive that life-saving birth dose of hepatitis B vaccine, putting them at high risk of developing life-ending liver cancer in later life. And we want to change that. So example, there's one Rotary Club in Nigeria that has committed itself to begin more support for vaccination, just as a case in point of how Rotary can help with this. What we're doing as a coalition, we're working with the US CDC and the World Health Organization to develop a community of practice to assist countries, beginning with those shaded red on this map, to develop a policy for hepatitis B birth dose vaccination, and then help develop a program to put that policy into action and get these newborns vaccinated with hepatitis B vaccine. So we're helping them with policy development, sharing lessons learned, how you scale up a program. And now we're seeking to get birth attendants more involved, because you really need to have the obstetrical staff give the vaccine so it can be given as soon as possible after birth. And we see a clear role for civil society organizations like Rotary clubs help out with education of pregnant women, families, clinicians, and help get the community mobilized as to how important this intervention is. So we're really right now calling out and searching for collaborations with civil society organizations such as Rotary to help us with this body of work. And we hope to really scale up these collaborations in the first quarter, of next year. So I would really appreciate any of you on the call that have an interest in learning more about this. We are anxious to hear from you. You can go to our website, globalhep.org. I encourage you to sign up for our newsletter, keep track of what we're doing, or follow us on Twitter. Here's my email. I look forward to having any follow-up conversations with any of you that are interested in this. We're very passionate about this, very committed about it. So we're 24/7 happy to talk about it. So thank you for your time. And if we have time, happy to answer questions now or in a follow-up discussion.
Dr. Ward, thanks so much. Excellent presentation. It's really, really interesting to see the work that's being done there that you're spearheading. We do have time for a couple of questions. Does anyone have any questions? If you want to put them in the chat, fine. I can't see everyone on the screen at one time, but feel free to raise your hands. I'll try and see if there's any questions that came out of it.
Dr. Jeremy, there is a question in the chat that says, if someone does not get the vaccine at birth, can he or she get it afterwards?
Right, a good question. You can get it afterwards, but and infants, the schedule is you get the birth dose, what's called the birth dose of hepatitis B vaccine, needs to be given in the first day of life to interrupt that transmission from mother to child. And if you get it afterwards, the newborn becomes infected. The hepatitis B vaccine is also part of the routine infant immunization schedule that's given typically around 2, 4, 6 months of age. And that's important to interrupt what's called horizontal transmission within family household when infants are getting exposed to very, very minute amounts of blood for a variety of reasons. Hepatitis B virus can live outside the body for up to 7 days, so you can get it exposed to it that way. So that's very important then, but you cannot get the vaccine later to interrupt mother to child transmission. You have to get it within that first day of life to be fully effective.
Dr. Ward, I see one other question in the chat from Geeta. Do the same areas have other vulnerabilities amongst mothers and children? Usually medical care for many disorders are poorly assessed in many of the same areas. And I mean, I presume in places like Africa where hepatitis is right.
Well, I know Africa has some of the highest maternal mortality rates in the world. So I know they have a number of issues to deal with. It's just that this particular intervention, one shot given by a birth attendant is fairly simple, very safe, and really has immense health benefits down the road. One particular challenge for Africa, as you may be aware of, is the large percentage of births that occur at home, and making it a challenge to get that timely birth dose to those infants in time to prevent that mother-to-child transmission. And there's a number of strategies to help with that, but that's one particular challenge in Africa that obviously poses other risks for the mother and child when that birth is not happening in the facility.
Dr. Wood, one last question from me. How do you think M. polio has affected the ability for you and your teams to deliver their vaccination programs? Has there been any benefit you've accrued from the success of M. polio's programs?
Not explicitly. But I think there should be. I think there could be. I mean, in talking to Rotary International last week with Victor Barnes and his team, we were talking about these committees in different countries that Rotary has helped develop to look after polio vaccination, and how they could begin to better mobilize resources for hepatitis B vaccination. That's number one. Functionally, I know that polio vaccine is given fairly quickly after birth, and I think that's a really key opportunity for integrating both of those. And obviously, if they can give one shot, they can give 2 shots.
Okay.
I think that's the other area that I would love to explore with Rotary about looking at that opportunity for collaboration.
That's excellent. Great. Partnerships and collaboration, definitely the way forward. Thank you so much again, Dr. Wood, for that presentation, but answering those questions. Please, if you could put your email into the chat, I'm sure other questions might come. So we'll now move on to our next presenter. We have, in fact, 2 Dr. Johns today. So we have Dr. John Ward. I'm now going to move on to introducing Dr. John Phillip. John Phillip is a surgeon, now retired. His specialty is the diagnosis and treatment of breast cancer. He's been a Rotarian for over 30 years and was a district governor for District 1040, which is in Yorkshire and Lincolnshire in the UK, during the 2008-2009 year. He's led several teams of volunteers to India to participate in national polio and immunization day campaigns, and has been heavily involved in a number of international humanitarian projects. He chairs the Rotary Fellowship of Healthcare Professionals and is currently involved in an international initiative to improve patient safety in healthcare, and also a campaign to ensure that medical equipment donations are done in a safe, sustainable manner. He's been a foundation cadre advisor for many years and involved in the auditing and valuation projects in many different countries. So please help me welcome Dr. Phillips today, who'll present on the pleasures of pitfalls of engaging in health improvement programs. Dr. Phillips, over to you.
It's a great pleasure to be with you this evening. As Jeremy just said, I have had the pleasure of engaging in a number of health improvement programs, mainly in low-income countries. I would like to share with you some of the pleasures and pitfalls I experienced. I used to think that whatever I did was good and I added value to other people's lives. But of late, I started to question this rather self-congratulatory attitude. I started questioning the value of some of the things I did. I started seeing pitfalls and shortcomings. Now, the take-home message from this talk is that it is hugely empowering and energizing to spend some time in self-reflection, individually, and I think more importantly, collectively as an organization. Let me share with you one experience. I once worked in northern Nigeria, what is now the Boko Haram territory, as the medical officer in charge of what was a WHO outpost. I had the responsibility then to periodically visit distant clinics which served isolated communities. During one such visit, I met a young girl in shock. She had high temperature and was in agony. After some hush-hush conversation, I realized that the girl had female genital mutilation. In addition to the sepsis and bleeding, the immediate problem was that she could not pass urine and had a very distended bladder. I had no medically acceptable way of helping her, but I could not leave the girl in agony. The only thing I had was a needle and a syringe. So I poked it into her bladder, and somehow avoiding vital organs, urine gushed out and there was immediate relief. I put her in the back of my Land Rover. After a long bumpy journey, she was safe in my health center. Now, the experience has left me broken. Was I reckless, heroic? Should I be pleased that I was able to help this young girl? The reality is that there are some 200 million women who have undergone FGM in 30 countries in Africa, in the Middle East, and in Asia. Does anyone care for them? Now, the reason I narrated this experience is that there are many communities with similar complex challenges, mostly neglected. Most live in the shadows. Prejudice, poverty, ignorance, illiteracy, conflicts all contribute to health inequalities. There are no quick fixes. Health improvement cannot be achieved in isolation. For sustained health improvement, we need to have a develop holistic strategies. Many years later, I was walking down the high street in Bongo, and that is there on your screen. This is in Ghana. I saw this young girl. She had high temperature. She was dehydrated and malnourished. I put her in a taxi and took her to a hospital. She died. The main cause was malaria. Malaria is one of the biggest killers in the world. It kills about 500,000 people in the world, including close to one child every 2 minutes. Despite the concerted efforts of many well-meaning organizations, global malaria infection and death rates have remained virtually unchanged since 2015. The reasons are complex, but the picture from the grassroots gives us points to ponder. There are over 100 NGOs involved in malaria eradication projects. In some countries, they are in competition with each other. They follow different strategies. Often, there is little community involvement. It has been estimated that in some endemic countries, the usage of donated malaria nets was as low as 6%. And now one study reported that 18.2% of the respondents used their nets for other purposes, such as fishing, protecting plants, and as football nets. Rotary has funded malaria projects for many years. I found 3 disjointed Rotary groups, but I could not find any validated outcome data. Thank God, Rotary has now invested $2 million plus $4 million from partner organizations to help Zambia become malaria-free. And I do look forward to updates from this big program and keep my fingers crossed. A surgeon asked me to help him in an operation, an emergency operation, to save the life of a pregnant woman. The surgeon assumed, rightly as it turned out later, that the woman had a ruptured uterus, a life-threatening condition. I scrubbed up using a bucket of water, which appeared not very clean to me. The surgery was done under local anesthetic with no means of recording blood pressure or other vital signs. There was no light. We operated using head torches. We pulled out a dead baby, but saved the life of the mother. With the help of a global grant and support of a team of volunteers, we refurbished the operating theater and subsequently transformed an abandoned building as a waiting hostel for pregnant women, both with reasonable outcomes. Now, I have led programs, health improvement programs in this country for the last 12 years. I have realized that there are no quick fixes. There have been ups and downs, pleasures and pitfalls. I've learned from my mistakes, and I can tell anyone engaging in similar projects what not to do. We Rotarians are engaged in a big way in health programs. 2 out of the 7 areas of focus aim to improve healthcare, disease prevention and treatment, and maternal and child health. Of the 27 Rotary Action Groups, 17 are engaged in health programs. But how is the impact of our programs measured? Are we too focused on the process rather than the outcomes? Many Rotary programs exist in isolation. Clubs and districts engage in health programs, often without tapping into the huge resources available within the organization. We fund many screening programs for diseases such as diabetes, tuberculosis, and cancer, often without understanding the efficacy of our intervention. I have no doubt that many benefit from these programs, but how many are falsely reassured? How many are wrongly diagnosed? We do fund treatment. Some patients do benefit, but how many patients are treated inappropriately and in a clinically unacceptable manner? How many actually come to harm? We have little knowledge about the long-term impact of our health programs. This is why we felt that the healthcare professionals need to come together and raise our collective voice. The Fellowship of Healthcare Professionals is a natural home of all healthcare professionals in Rotary and beyond. Our aim is to help deliver safe and respectful healthcare to everyone, everywhere. Now, we work through subcommittees by special interest groups, and I do want to mention 2. 134 million adverse events occur each year due to unsafe care in hospitals in low and middle income countries, contributing to 2.6 million deaths annually. Some of these result from Rotary programs. one Rotary subgroup led by Rotary International Director-elect Pat has initiated a global campaign about patient safety. Another subgroup is looking at the complexities of donating medical equipment. Such donations are important, help colleagues in many low-income countries to provide vital clinical services. But a survey of Rotarians engaged in medical equipment donation was rather unflattering. In line with global statistics, only 10 to 30% of donated medical equipment is actually put into service in the recipient countries. Now, I have seen lives changed by Rotarians. I do want to see more lives being changed for the better. But I believe we can do better than what we are doing now. To map a path from process to outcomes, to safer delivery, we need to reassess what we are doing, how we are doing, what impact our programs have, and what, if any, harm we might be doing. Thank you for listening to me. I'll be happy to answer any questions.
Dr. John, thank you so much for that very, very pertinent presentation, asking some hard, important questions there. So we have time, I think, perhaps for one question. If anyone has a question from the floor, if not, Dr. John, perhaps you could also put your email into the chat so we can connect you later. But the work you're doing there with the Rotary Fellowship of Healthcare Professionals in bringing us together and making sure that we're effective and can achieve the optimum impact and adopt the correct processes, I think is exceptionally valuable. So thanks again. Any questions for Dr. John? Okay, I think you've convinced us all, obviously. Okay, Geeta, I see Geeta waving up. Can I unmute Geeta, please?
I put it in the chat that
I'm sorry, I didn't see it.
To David, I think. I thought David was the host, so I sent it to David.
You did put it there, but it was not read as a question, so I did not address it yet.
Okay.
So I will address.
John is a very good friend. I belong to his fellowship, so I addressed it to John. Yes.
Lovely to see you, Geeta.
Do you want to ask it, Geeta?
Yeah. Let me just say this. We as Rotarians have different projects that are medically related. We're all working in silos and honestly in a haphazard, uncoordinated fashion. I think if all of our rags that are medically related rags work together as a team, then we will have a multidisciplinary team for maximum impact if we work together. The second thing I wanted to tell John was I wanted to invite all of the physicians who are working anywhere to come to the Armstrong Institute of Patient Safety, which we've established at Hopkins a long time ago, for training and maybe supervision, or we can do a Zoom training for everybody, because you're absolutely right. We have a whole lot of heart in what we're doing, but we're not establishing how the outcomes are measured. And we certainly don't look at what errors we made so that we avoid them again. Thank you, John. I mean, John is this remarkable leader of the doctors across the world, and we all love him, and we keep electing him president every year.
Okay.
This is
Thank
not
you.
John Philip Admiration Society. Thank you, Geeta, for those.
Thank you, Geeta.
kind
Thank you,
words.
Dr. John. That is excellent and great points, all of you. Okay, so we're now going to move on to our third presentation for the day. It's my pleasure to introduce past ARA Director Brad Howard, who's going to give us an update on the Rotary Family Health Days. Many of you know Brad, but I'll just briefly recap for those who don't. He's a past district governor of District 5170, was a member of the Rotary Board of Directors from 2015-17 to 2016-17. He served as chairman of the executive committee of the board, as Peter is now, and he currently serves as an aide to Jennifer Jones, who of course is the 2022-23 Rotary president. If you don't mind, Brad, I'm going to leave the rest of your introduction and I'll put it into the chat, and I'll just hand over straight to you. Brad, welcome.
Thank you very much. It's my pleasure to be here. It's nice to be the one non-medical professional that will be presenting to you. So if you have any medical questions, I'm going to defer them to John Phillip, who is actually our technical advisor from the cadre for the Rotary Family Health Group Rifa that I'm going to be talking to you about. It's great to be here, and it's great to see all of you in this effort. So what my hope is to be able to share with you a bit of information that will help you to understand what the Rotary Action Group for Family Health and AIDS Prevention is. What I'm going to be trying to help you to understand is who we are, really what we do, why we exist, and how this affects the people of Africa. And having listened to John's just recent presentation, we are very focused at these outcomes that he's spoken to, and trying to understand as to how we can help community health within Africa. So let me just share with you what we do. What in fact we are is an action group that is focused on the partnerships and projects aimed at the improvement of community health and the prevention of HIV and AIDS in Africa. We say partnerships because a key part of what we do is coordinate with governments, with other nonprofit organizations, and with for-profit organizations to bring sustainable community health programs to Africa. This program started off actually as a passion project from a Rotarian from your part of the world who's actually on this called Marion Bunch, who lost her son to AIDS. And the initial focus was to really focus on AIDS and HIV prevention and education, initially in Africa, South Africa more specifically, but since our inception in the early 2000s, we've been evolving from the singular focus to recognizing and addressing preventative healthcare in one country, from one country to many countries throughout Africa and somewhat beyond. So why are we here? It's really to create these partnerships and these programs that will help the local community, the local health communities within Africa provide more sustainable healthcare, and to provide interventions, healthcare interventions, where there's large gaps in these communities. I think, Geeta, you asked that question, I believe, in the first presentation. And while I doubt that we are solving the problem, our purpose is to affect the answers to the problem. As you can see, the problem we're trying to address is rather large. If it wasn't that you've heard about hepatitis or malaria, there's many more issues. HIV is a huge issue within Africa. We are attempting to deal with the stark reality that throughout the world, and particularly in Africa, governments are not able to sustain healthcare. I can remember that once we had a group of us that were calling on the minister in Ghana to pay our respects before we did the National Immunization Day for polio. And we were in his office for an hour before he arrived. When he arrived, he apologized, but he had been in some other part of his country dealing with a virus that was infecting people and causing immediate death was in this community. And you suddenly realize this person was just running from one spot in the dam where they put in their finger to the other spot in the dam where they were putting in their finger. So in many parts of Africa, they just don't have the ability to sustain healthcare on a level that is necessary for their populations. So what we believe we have the opportunity to do is to come in and supplement that and build up community healthcare where possible. So who we are, we're a Rotary Action Group, as you've heard. It's recognized by Rotary, and we have members from throughout the world. We have a number of people on our board from throughout the world: Africa, India, North America, Europe. What we are is the second largest disease prevention program after Polio Plus for Rotary. We've worked in 11 African countries. We've also worked in India. We are a 501c3 nonprofit organization headquartered in Atlanta. Further to that, we are also in strategic alignment with the World Health Organization's Sustainable Millennial Development Goals. Two of the key parts of the of the areas of focus for Rotary: the disease prevention, maternal and child health. And we also align with each country's government priorities as identified in their national operational plans, their campaigns, and their vision. Our signature program is called Rotary Family Health Days. You may have actually just read about this. If you picked up the December issue of the Rotarian and read President Shekar's message, he highlighted this program. And if you don't know where that is, Page 1, right-hand column, 5th sentence down, you can find a mention of Rotary Family Health Days. This was an evolutionary part of RIFA that happened back in the early 2000s when a gentleman, a past district governor from Uganda, Stephen Mwangi, started to ask the question of, could we do these family health days, these family camps, health camps, and would it be effective? In the first year, the hope was that we would just have a few thousand people and call it successful. When in fact, the tent doors opened to the very first Rotary Family Health Day we had, it was an overwhelming outpouring of number of people, far more than was envisioned. And we knew that there was a need that was being addressed from that. So what are these? The Rotary Family Health Days are a unique private and public partnership that comes together that has a chance to have an effect on the community health, where hundreds of thousands of people receive healthcare during a family health day. Normally they're a 3-day session, which has an integrated annual program that provides free and holistic, comprehensive and preventative health programs, both for communicable and non-communicable diseases. Each individual on average receives about 7.5 healthcare interventions, 7.5, whereas normally in these parts of the world, in order to get any healthcare, you normally have to get on some form of public transit and travel for long distances if you can. We do screening, testing, consultancies, vaccinations, and treatments with the goal of connecting them to their local healthcare system so that they can have sustainable healthcare. And in doing this, we view ourselves as a central part of a multifaceted program, one where we're not standing alone, but actually acting as a coordinator in these parts of the world. This program is delivered through a massive public-private partnership. The leverage of the public partnership model is seen here. The funding partners are primarily through global grants, for which RIFA can assist with providing templates and sometimes identifying the international funding partners. The non-governmental organizations in the country assist with medical and technical services. The Ministry of Health is actually a primary planning partner because they identify the need to help and deliver the core services often. And I want to emphasize this, we don't come in and tell them what they need. In fact, it's a very community-based process to determine what the healthcare needs are there. And then we lean into our expertise, our resources, and our partners to be able to provide it. The media, we get free media that promotes the events and mobilizes the community. The US government is funding a lot of the NGOs at the site level. The Rotary clubs are mobilizing the community and doing the challenging task of identifying and building out these RIFA, these Rotary Family Health Days sites by bringing together the manpower and the volunteer support. And the community stakeholder are the critical people who ensure that the appropriate needs are being met, and ideally coming alongside the Rotarians in the collaborative effort to learn how to serve and provide more for their own people. RIFA is the convening organization responsible for looking for external funding, assuring quality control, monitoring and evaluation, and reporting structures and support. We cover a list of diseases, and you can put probably more on this list even now. And yes, while governments in Africa right now are controlling the approach to COVID, we envision that as the bell curve goes and we're trying to get everyone immunized, that we are trying to be in a position to be of service to do the facilitation of COVID vaccines at one point. At this point, again, it's all in the hands of government health ministries and not in our hands. In many of these places, the governments are still struggling at just being able to provide the very basic of services. Therefore, this need for supplemental and sustainable healthcare is necessary, much as was the case with the eradication of polio. They did not have the ability to be able to elevate their healthcare system to raise the level of immunizations. Meanwhile, we were able to come in, vaccinate the children while they build up their process of having regular vaccines for the children as they come along. We're providing much, if you will, the same. And so what have we been able to do? Well, we've been able to address more than 2.5 million people who've been served across the globe. And when I say the globe, over the time that we have been really doing these Rotary Family Health Days, we've increased the number of countries we've been able to affect and our impact significantly. But perhaps even more importantly than that is the total impact of Rotary Family Health Days have really driven to not just more than 2.5 million. It's been the membership and evaluation tools that we've been able to use and refine, and the service package that has expanded in most countries. And this allows us to be amplifying our effect to such a degree that these are the list of the countries that we've had an effect on. And what's important is the program valuation, which I'll show you what it comprises thereof, is over almost $45 million for an investment of less than 1.2 million. 1.2 coming through the funding of our grants, and the rest of them are the way that we're able to amplify this within the local communities. And so here you can get a sense of what is driving that valuation, whether it be the valuation of our volunteers, medical staff, the other partners, the media that we're able to bring in, or the cash that we're able to generate. And so when we brought in this private consulting firm to give us an understanding of how we could measure this, this is what they told us. Truly a good value, if you will, for the outcomes that we're generating. But beyond that, what we really are able to do is add value to our Rotarians, both in country, those people who are on the front lines to raise the profile of our effect of what our Rotarians do in the African countries that they're there. But even well beyond that, it's to address the current topics and needs, attract more members, both locally and internationally, who have a passion for these types of projects, and to align ourselves with the government. What's been very interesting, at least for me as someone coming on the board of RIFA, is how many of the governments of Africa are approaching us. The government of South Africa, in fact, mandated that we had Rotary be one of the driving forces of the announcement of the World AIDS Day that was just announced recently. We were there. They asked if President-elect Jennifer would please provide a message. And this was at their request, as opposed to us saying, could we do this? It is that level of activity that in fact has really raised the profile of a lot of what we've been able to do in Africa. Our next opportunity of what we'll be able to do is in Nigeria. And that'll be a Rotary Family Health Day, February 17th through 18th, where we plan on having more than 120 sites that will be in the 4 different districts in Nigeria. You can see the list of things we will be doing. There's a global grant that has been formed. And in fact, 2 people, one of your own, PDG Nancy Barbie, is helping us raise funds, and trustee, past RI director Larry Lunsford is also raising funds. If any of you have an interest in anything that I've said and would like to be a part of it, whether it be an advocate for us or a partner in this global grant in Nigeria for the Rotary Family Health Days, you are more than invited. And I'll leave this on the screen for just a moment so you could write down one of their 2 email addresses to be able to share that you'd be interested in participating in. We live by one of the quotes from one of the greats in Africa: a new world will be won not by those who stand at a distance with their arms folded, but those who are in the arena. And for those folks that are our brothers and sisters in Rotary in Africa, they are on the front lines of a lot of this. They're the ones that are guiding us, working with the local organizations and educating us as we go forward. And so for all of you who've been able to listen to this and appreciate it, thank you. If there's any questions, I'd be happy to answer it. And if not, Marion's on the call and she can answer it. Thank you.
Brad, thank you so much for that presentation. It's intriguing. It never ceases to amaze me how little I know about what Rotary does globally, and these Zoomformation calls really lets us know how broad and wide what we do is, and how effective it is and the impact. We have a question from PDG Isaac saying, how do you decide which country to go to? There are so many countries who need your help, Brad.
Thank you, and good to hear from you, PDG Isaac. Well, there's a variety of them. First, we have what we call a strategic alliance countries, where we create a contractual relationship with the Rotary leadership there, so they understand what they're to provide and what we are to provide. So part of it is it's driven by the local Rotarians saying, yes, we would like to bring this resource into our country. And we're aggressive with that towards the end, that we make sure that all the countries of Africa are aware of this. We're working with incoming director Patrick Chisanga, who's actually been a past board member. We work with a number of other organizations. Tomorrow, in fact, tomorrow morning, we're going to be having a conversation with the director of the Rockefeller Foundation, a gentleman by the name of William Asika, who used to be on our board, who is also guiding us into which countries and which issues should be there. So from our standpoint, it's largely driven by the people of Africa, whether it be the governments that give us an insight as to the needs, the Rotarians who join us in these strategic alliance agreements, or if we see an outside opportunity, we will reach out through the Rotary channels. But it must be grounded in having the local Rotarian leadership accept responsibility and the relationship, because it's more than just holding these events. It's the monitoring, the standards that we try to achieve, and the working with the local governments that are essential as a part of what we do.
Thank you, Brad. Any last questions before we jump off? And I know Marion will be available as well for any questions that any of us may have at a later date, or to help us if we want to be part of this Rotary Action Group and the wonderful work that they are doing, or any of the other presenters are doing their programs as we move forward. So, okay, it's now comes time to wish you all the very best on behalf of Director Peter, who I'm sure is sitting under a palm tree by now, enjoying whatever beverage the USVI has decided to serve up to him. We collectively wish you, on behalf of the zone teams that are here, an exceptional holidays. May it be peaceful, may it be full of joy for you and your families, and may we continue to do the amazing work we do around the world. Have a wonderful time with you and your families. We look forward to seeing you in the next Zoomformation call, January 10th at 1 p.m. We're giving you a bit of a rest at the beginning of the year. Take care, look after yourselves, keep up the great work. Thanks, everybody.